for joining us. We are Team 2 representing Deloitte to discuss how to implement this new DVS option with the $100,000 grant. I am Ryan Plattner.
I'm Jolie.
J.D. Hector. I'm Tommy Darcy.
So in discussing what we're recommending, we're first going to start with an executive summary and a problem statement. We're then going to discuss the assumptions that we made in doing our analysis, as well as the process, people, and technology involved, followed by some challenges and a conclusion. The executive summary, what is the situation? Basically, there are $100,000 out there that DCH has given us in order to transfer veterans from Medicaid over to VA benefits. And that will be good both for the veterans getting better benefits for themselves, as well as the state saving a lot of money. How did we get here? Well, two of the biggest reasons are the possible $170 million in savings that the state can gain from this, as well as the 138,000 veterans that can be transferred over and get better benefits for themselves from Medicaid. So, what is the problem we're facing? There are 138,000 people, as I said, that could have better benefits. These are veterans, these are people America cares very much about. And the solution we've come up with is to develop an IT system that would integrate with the Medicaid system that's currently in place to identify those veterans and migrate them over into a better health care coverage system for themselves. The assumptions we made, there were 4 key ones. First one is that VA benefits are beneficial and they're desirable to all veterans. We also assume that no veterans, whether they're eligible for both or not, are going to be enrolled in both Medicaid and VA benefits at the same time. We assume that all veterans are going to like their benefits and reapply and continue next year, and also that any veteran that wants to enroll, and we're assuming again that all of them will, we're assuming that all of them that want to will be able.
So regarding the process, first things first, and to get us up and running, we had to start a procurement process to get a firm that designs and develops this system to get it in place. Throughout this process, Paris is going to be hand-holding us while we go through this and sharing their experience with us. And so the second part of the process is for us to modify the Medicaid enrollment process and insert these screening tools that redirect the applicant to the appropriate program, be that the VA. The DVS is going to have a huge increase in the number of caseloads, so their infrastructure is going to be is going to have to be upgraded. And we're going to have to hire, the state is going to have to hire additional staff to support this increase in enrollment, train the DCH on the new system and the new process, and what the new eligibility requirements mean under the new ACA reform. And just for visualization, we've highlighted the first 90 days, and we think that the critical milestones are to get the procurement process up and running and have a decision as to who is going to do the system design and development. By March 30th, we have to have the system design process started. Then system development and testing for another 4 months, and then the system installation almost at the end of the year for October, November, and a month of piloting and troubleshooting and tweaking before we make it live. And throughout this process, throughout the entire year, Paris is going to be hand-holding us while we do the knowledge sharing.
And now, in order to be able to attain these objectives, as we go along, we came up with a number of measures for success. Obviously, the main goal is for the veterans to be transferred over from Medicaid to get the VA benefits. So that will be the number that will get the most. The second will be the cost savings, which will be accumulated as the years go by for the state. The third is the response time for troubleshooting. As with any technological upgrades or modifications, there will be bugs, there will be issues that come along, even when things are running smoothly. And so we want the response times for those to stay consistently low or to decrease completely. And we also want the website to be up and running as often as we can with minimal time for construction. And so with that, we came up with a 5-year plan. The first year will be the procurement, implementation, design, and we want we want the system to be fully in place, and ready to go in order to be able to handle the large increase in capacity. And we want, by year 5, we want almost for all of the veterans who we can transfer over, we want them transferred over. And with that, there will be about $160 to $170 million in savings for the state. And we also want the response times to be down to one day. We want our issues to be fixed for people who are having problems with their computers. And this will also, and the more veterans that we transfer over, the less time that will be required of DCH to handle their Medicaid application. And now for those things to work, we need some quality controls. Deloitte, along with key members of the state board, would have to have quarterly benchmarking operational assessments. The first year is very important. We need to make sure that things are running smoothly, and if any issues do pop up, we're there to handle it and do it quickly. And then we can meet less often as the years go on, hopefully as the process gets smoother. And with this, we will continue our communications with the stakeholders throughout the entire process.
And speaking of which, people, the stakeholders are important to the success of this new project. And so it's important to first understand sort of the goals of our stakeholders. So briefly, we have the department and the agencies. And the goals here are to serve the citizens in the best way possible, but also at the lowest cost possible. Veterans, likewise, it's very important. It's their health care, and they're concerned with getting the best quality health care. And taxpayers. Taxpayers are funding these programs, and they want an effective use of their funds, but they are supportive of Americans' veterans, and that is something they are willing to spend some money on. So with that, and with the goals in mind, we need to understand we have a limited number of resources, so we need to prioritize who to reach first when coming up with an engagement action plan. So kind of the most important to the initial startup is going to be the agencies, because it's the day-to-day staff that are going to have to modify how they're conducting their practices currently. They're going to be modifying the website and having an increased number of veterans that they're serving on DEBS. So with that in mind, we first need to make sure that the staff at the agencies are trained. We need to get not only for the new, under the ACA, the eligibility requirements, but also understand the website itself, the infrastructure, so they can help the veterans that are struggling in filling out these forms. We need to also get the policymakers to understand the benefits, because they're going to be funding, and it's important that they understand the benefits and how that's going to have savings for their state for other programs that they may be interested in funding. And similarly, we want the veterans to understand that the state is doing this in their best interest, and they're able to receive treatment for a wider array of the treatments and at a lower cost to them. So it's important that they understand, first for the 138,000 that are going to be moved from the Medicaid system to the DVS, but also to reach out to those 270,000 that are eligible for VA benefits but aren't receiving them simply because they haven't applied to the Medicaid system. And with that, low-cost things such as social media activism, reaching out through news, and other sources.
So when we envisioned a process that would streamline the whole thing in this implementation strategy, what we wanted to do is we wanted to come up with something that was simple, easy, user-friendly. And the thing that we came up with is that we wanted to have a screening process on the front end. So just to walk you through it, when somebody would come in and they would fill out some very basic information. It wouldn't determine their eligibility, but it would flag them if they may be eligible for VA benefits, and then immediately kick them over to the VA to then process their claim first. Over the long term, and this is something that Lloyd could help with, we would want to reassess the infrastructure over the course of several years in the implementation process, make sure that they stay on task, make sure that it's able to handle the volume of applicants that we expect to receive. And there were some challenges. Stakeholder buy-in. You're going to have a lot of coordination with these two agencies now that didn't quite work together as well in the past, DVS and the DCH. Because you're going to have them applying for two different services, and we're going to have to integrate with the current enrollment process. That's going to be an issue. Make sure the personnel are trained and able to walk users through the process. Making sure it's user-friendly, not only for those who have that maybe they may not be tech savvy. We need to have people that can walk them through that. The cost is on the front end for this. We can recoup it over time, but that is kind of the drawback. We need that, those initial fundings on the front end. And last, we were concerned about HIPAA, privacy, other concerns like that. That's why we didn't want to delve into the applicant pool that was already in existence and mess with people's information. So we wanted to create a secure thing on the front end and make sure that people are going to the right place.
Sorry, will you go back to slide, was it 8? Okay, so for number 4, hire additional staff to support the increase in enrollment. Have you talked with DVS about how many staff this would be and what's their current capacity?
Not discussed that with them. Our main focus here actually was almost the reverse, was alleviating the stress that was on DCH. So the more people we can get off Medicaid, the more quickly they can process their own applications. So DVS has not expressed the fact that they're overwhelmed at the moment, or that they're, especially overburdened. So we haven't discussed actual numbers. We were thinking it wouldn't take I'd say more than a dozen or so at the most to train on this new system, since it is all digital and should be relatively easy.
I'd like to add that the stakeholder engagement plan really shows us that we need to identify staffing needs. So we're not going to know what the growth rate is immediately, but that's part of the stakeholder engagement plan, to identify these needs and these training needs.
So I had a question about this process. So you talked about, the new system would identify them as a veteran and kick them over to the VA. So does that stop their Medicaid processing? So they've begun a Medicaid application. What happens to that?
So I think that talking about going on the front end, they go onto the Medicaid website, they want to fill out this application, and after you click continue to application, there's going to be a screening process. There's going to be a series of questions which are designed to kind of flag potentially eligible veterans. So if it finds through those answers that that's the case, that they may be eligible, it's going to provide a link to go straight to the application that would best serve them.
We also have 2 key assumptions there. No dual enrollment, as we listed out, and then that all the veterans that are eligible will prefer to enroll.
They have to choose which one they want to apply for after you provide the link.
That's an assumption that they will prefer the VA.
Once they get directed to the VA benefits, our assumption is that they will continue to fill that out and enroll in such coverage.
Which also ties into the engagement plan and trying to inform veterans about the benefits that they can receive under the VA as opposed to Medicaid.
Right, our assumption was that they're only in Medicaid because they don't know about their VA eligibility.
I think the next slide, slide 9, is your implementation timeline. You're in a procurement process. What's being procured?
Design and development.
What does that mean?
The designing of the IT system and the coding and the development of the same system.
And Deloitte is doing that?
We would like you to consider that.
So, because my question is, in procurement, are you looking for an integrator? Are you going to bring an integrator under contract to do that? Because you also have a system design step below that. So you see my confusion. In procurement, you're saying we're doing system design, and then we have another 3 months of system design below that. I'm trying to reconcile those 2.
That's right. The procurement process is just to decide on who's going to do the system design and development. The same firm is going to do both, because we just want the same player to be on both timelines, right? So this is the timeline for the system design. That's where they're actually doing it, and the rest of this when they're developing the actual system.
Okay. So theoretically, if we were to engage a third-party vendor to do the design and development, would we not want that vendor to develop the timeline for design, development, testing, and implementation? Or are we going to impose that timeline on them as part of procurement?
No, this is just a suggestion.
but one we made with understanding that this seems to be a reasonable expectation. If you like a timeline in line, this seems to be a reasonable expectation for when anyone can get this site up and running for the state.
The stakeholder engagement plan, I have a few questions. I don't know which one I'll start with. I only have one, I guess. Could you talk about how we're going to engage policymakers and what our strategy will be? Kind of told us what we're doing, but how are we going to execute that?
I think largely because DVS is a federally funded program, you as a state almost are responsible to the federal government and the national taxpayers to, explain what's going on, why this is beneficial. Whereas if you're not, they're going to be asking questions. They're going to want to know what you're doing with that money. How is it benefiting these people that we all care so much about? So the outreach is necessary it's more of an information exchange to make sure that they're keeping abreast of what's going on.
Looking to my boss, I think I'm out of time. All right, thank you.